Welcome to the webinar, one of our many new media webinars. This particular webinar, today will have Elizabeth Scott, who is the Principal Consultant for Raven New Media, which is a company specializing in new media and social media for healthcare organizations. And Ms. Scott was formerly the Associate Vice President of Marketing and eBusiness for Norton Healthcare. So at this time, I'd like to switch over to Elizabeth Scott and let her begin her presentation focusing on new media marketing hybrids.
Thank you, Emily. Thank you so much for that introduction, and thank you to Q1 Productions for this webinar. As Emily mentioned, I'm Elizabeth Scott, and I specialize in new media for healthcare systems and healthcare organizations. I like to start out our presentation talking about hybrids with a cute little comic strip that ends with, "This is out of control." And I love this strip because as we delve into new media more and more, we're learning that it's not just a trend. It really is going to be an integral part of our marketing mix. So let's get started. A little bit about Raven New Media. Again, Emily mentioned that we specialize in interactive and e-business services and certainly new media for hospitals and healthcare. But we also do web audits, marketing plans, everything from dark site planning to e-business team training. Well, here we are. We are living in a world of new media, social media. It grows every day. And for many of you, probably looking at this screen alone is intimidating and overwhelming. Well, we're going to break it down a little bit, and we're going to talk a little bit how your new marketing hybrid can help you navigate through new and social media. You're probably familiar with the most common of social media, and that's the social networking sites, such as MySpace, Facebook, Friendster, perhaps, Zanga, or Dogster, and that's one of my favorites. Even if you're not familiar with social networking or you've never been on a social networking site, it really doesn't matter. It's so important that you understand the core concept around social media and social networking so that you can understand how you can integrate that into your department. Social media, of course, offers an online outlet for you to connect. It's an opportunity for marketers. Particularly, healthcare marketers, when faced with new media, should really do 5 things. It's really about looking, really observing new media, listening, and that's really listening online to what consumers are saying, healthcare consumers. React internally, go back to your team and say, here's what they're saying. How should we respond? Respond, of course, and you can respond not just in your social media presence, but certainly in your traditional media presence, and then track that response. As I mentioned before, social media is really more than just social sites. So I want to broaden your horizon and your understanding about social media. Consider video and photo sharing, really simple syndication RSSs, chat rooms, message boards, podcasts. All of this is part of the social media world. Also, we tend to use a lot of different names for social media, and it can be very confusing in your own definition and also as you talk to your healthcare colleagues. So I thought this slide might be helpful to kind of break it down a little bit. New media is also known as Web 2.0. It's interactive PR. There are lots of modes of new media. It could be mobile, it could be gaming, interactive TV. Most commonly it's web. A lot of the features of new media is electronic, interactive, consumer-controlled. And I think most importantly, the new media functions are important to understand. It really allows our users, our healthcare consumers, to control and participate. It's a relationship-building medium, and it's a new form of communication that will overlap with your traditional forms of communication and marketing. And look for a huge increase in volume and speed of communication. We'll talk about that a little bit later. Specifically, as you look at your websites, there are a lot of things that can be categorized as new media applications. You probably have a number of these elements, and you may be considering some more. Some of the more progressive ones that may be of interest may be 2D barcoding or online gaming, but e-newsletters and cheer cards and interactive surveys, things like that have been around for a while, and that's really part of the new media realm. I find this slide very compelling because it tells us something. What do consumers look for in companies? Should they have a presence in social media? And again, I think most are saying, yes, companies, including healthcare, should have a presence in social media, but only interact with customers as needed or by request. Please remember this. I think the temptation is to jump into new media and participate as an entity, as an organization, as an expert. But really, our opportunity lies in looking, listening, reacting, responding, and then tracking. Next to search engine marketing, social network sites are the most popular online marketing tool. I found this a little surprising, but again, it's a sign of the times and something we need to be aware of as we move forward with our media planning. Again, you may hear pushback around new media saying, oh, you know, that's really Gen Y, that's really for the young kids. My kid has a Facebook page, and, you know, they're always Twittering. It's really not. The demographics for social media are changing, and changing very quickly. As you can see, just Facebook alone, 40% of the active users are 35 years old or older. When you start adding a lot of the other common social media sites, social networking sites, excuse me, you can get up to 71% that are 25 years old or older. So really, we need to think about that skew and where our healthcare consumers are. So what should be on your radar as you think about social media? We've talked about a few things. Well, two things I want to leave you with, just kind of spinning in your brain, and that's hyper-targeting and aggregate social sites. Hyper-targeting is fascinating. If you're not familiar with hyper-targeting, it's really something that's being used on social sites. It's not about keywords. I know a lot of us have just gotten used to our online abstracts for our websites and our keywords and making sure that SEO for our sites is clean and streamlined. But now it's really about what they say they do and monitoring that. Again, watching patterns, being able to pick up on the consumer experience. There's some early results on hyper-targeting. Some of the large organizations are using it, and it's proving to be very effective. The second thing is really aggregate sites. Aggregate sites are very interesting and a little scary. That we are bombarded with so many social media sites and so many things to track that, of course, the natural progression of technology is to build aggregate sites, places where you can watch everything. This particular example is with Spokio, an aggregate site. Spokio mined, with my permission, mined my Yahoo email address book, pulled my friends and contacts, and I'm graciously using with one of my friends who is allowing me to use her profile. And you're going to see some very interesting things.